I'll start by just addressing the wet nose. I think there is something to the myth that a moist nose is generally a healthy nose and that it shows a pet is well hydrated. But there are a lot of situations where a wet nose can also be a sign of illness. So it's definitely not the only thing we should be looking at.
Welcome to MythBarkers, where we make dog parenting easier by sniffing out the facts and debunking dog tales. Yena, I'm so excited. This is officially our first episode, and really excited. I'm going to let you introduce her.
Absolutely. Dr. Sara Witherell, thank you so much for joining us. This is actually our first ever episode, and we are so grateful and thankful that you are our first guest. So I met Dr. Witherell maybe about a decade ago, and we visited the Animal Kind Veterinary Hospital in Park Slope, and she's really looked after both Bodhi and Luke. Luke, it requires a lot of prep and care to be seen, and she has always been such a champion to both of our dogs and given them the best health advice. So very excited to welcome you today.
Well, thank you so much for having me. I'm really excited to do this and hopefully to share a little bit of my experience with your audience. So
thank you so much. So I understand you're born and raised from Michigan, and you studied at Michigan State University, where you got your degree in veterinary medicine.
Mm-hmm.
And you've been practicing and a certified doctor of veterinary medicine for over 20 years. You're currently at Animal Kind Veterinary Hospital in Brooklyn, and you live in Brooklyn as well with, I think you have a rescue dog, Pax?
I do. I have a 2-year-old that we've owned for about a year and a half, and he's all sorts of trouble and all sorts of fun. So, yeah.
We can definitely agree to that with rescue dogs. They are very unexpected in so many different ways, but the experience is beautiful.
Yeah, it really is. He's my second rescue dog as an adult, and, so different than the first, as I know you can attest to as well. They're never the same.
They're all different people. Their personalities are very, very... Should we hop into the questions?
Yeah,
Sure.
Let's get going.
Okay, so Dr. Witherell, tell us about your first dog or the dog that made you want to dedicate your life to animals.
Okay, well, I guess I'll talk about 2 dogs here. My first dog actually was as an adult in veterinary school. Her name was Lily, and I adopted her as a rescue through our spay-neuter program in school. And the reason that she was my first dog was, as a child, I had 2 working parents. I was an only child and really didn't have the time or energy to have a dog in the house. And so she was about a year when I got her. She had terrible separation anxiety and was very nervous around other dogs, but really liked people. She was an amazing dog. We had her for 13 years. And she moved to Brooklyn here with us, and I still had her when I started working at Animal Kind.
Wow.
And she taught me a lot about dog behavior, which is something we don't get a lot of in veterinary school, and I think a big part of owning rescue animals in particular. So that was a really good experience for me.
I could see a lot of that reflect when I take Luke in for vet visits, because he's a reactive dog. And, I stressed about it personally, but there's such a great process to onboard reactive dogs that I found it really, really seamless. And I found it to be such a great experience. So I believe that your dog definitely helped you navigate these situations.
And so what made you want to become a vet and dedicate your life to serving animals?
So I guess there I'll go back to sort of the first dog that I really bonded with probably was the dog belonging to my aunt. And she had 2 dogs that were just amazing and really fun, both rescue dogs. And so they were sort of my surrogate dogs as a child. They were named Bones and Thurber.
I
Thurber
love
was
that.
a little pit bull, and Bones, I think, was some sort of cockapoo mix. And, so I grew up with them. As a young child, I took care of all the neighbors' pets because I didn't have my own in the home. And then just sort of happened into my first job at a veterinary clinic, recommended by a friend, and learned there that my love of science and my love of animals could be a career.
How long does it take to kind of study and then become ultimately a practicing vet? What's that process like?
So it varies from person to person. Most people will do some sort of 2 to 4 year undergraduate degree, depending on where they're applying, which can be pretty broad-based, but usually with some sort of science focus, then go on to a 4-year graduate program in veterinary science. And then these days, most of us actually do postgraduate education as well, either internship or move into a specialty area. I personally did a 1-year small animal internship after veterinary school at Michigan State, and then did an in-practice residency in sort of general practice after that. And so we're lucky these days that I think our veterinarians are very highly trained.
Absolutely.
You can certainly go into practice right after 4 years of veterinary school as well, which was something that was more common, 20, 30 years ago.
Great to learn
Yeah.
that. And what is the favorite part of your job?
I think the favorite part that's always been there is really just getting to know the animals and how unique they are and interacting with them. The part that I think I didn't realize I would like when I got into this was the relationships I build with people and pet families. Most of us don't get into it because we're really excited to work with people. We get into it because we're really excited to work with dogs. But I think those of us that stay in general practice do it because we realize how much fun it is and how rewarding it is to get to know families over decades, to get to know new pets in the family, new kids in the family. That can be a really fun part of the job as well.
Meaningful that by helping the animals, you also really help the families, because these families care so much about their loved animals that when they're sick, it's devastating. And the fact that they have a trusted place they can go to where they can get really good care for their dogs and cats, I think is a really beautiful thing. So thank you for doing that.
I think the other side of it, too, is it's really great to have engaged clients like yourself who really value continuity of care, value forming a relationship with someone, because I think that is one of the most important things of any type of healthcare is getting to know the person, especially, and being able to know where they're coming from, what their bond with their pet is, what the relationship is when we're making recommendations as well.
So I said it before, I'll say it a million more times, but we really want to help make pet parenting easier, right? So we'd love to tap into your expertise and kind of pick your brain on some things. And being that we're MythBarkers, we like to frame all of our episodes around myths or shifting misperceptions and educating people. I think there's a well-known misunderstanding about pet parenting that a wet nose is a sign of a healthy dog. Can we break that apart? What is that? Is that true? Is that false? What are the signs of a healthy dog and conversely an unhealthy dog?
Sure. I'll start by just addressing the wet nose. And I would say both wet and dry noses can be healthy. I think there is something to the myth that a moist nose is generally a healthy nose and that it shows a pet is well hydrated. Dogs do actually lick their noses to enhance their sense of smell, but there are a lot of situations where a wet nose can also be a sign of illness. So it's definitely not the only thing we should be looking at. Dogs with upper respiratory infections can have a wet nose because they're having nasal discharge.
Wow.
Conversely, a dog with a dry nose can be perfectly healthy. So some dogs just naturally have a drier nose, and depending on what climate we live in, how dry or how humid it is, how hot it is, a dry nose certainly can be normal even in a well-hydrated dog. I think the thing people relay to me often is they suspect their dog has a fever with a dry nose, which seems logical, but just doesn't seem to actually relate into, whether or not their body temperature is elevated.
What are some of them the key signs of a healthy dog? Or are there anything that you look at when you're checking out a dog immediately that you're, trained to look for?
On my end of things, what I'm paying attention to when a new pet comes into the exam room, I'm looking to see, are they interactive? Are they curious? How are they interacting with the people and their environment? That's both a health and a behavior assessment. Even before I put hands on the pet, I'm watching those things, and that can tell me a lot. How did they walk into the room? Are they limping? How are they interacting? And as with new puppies in particular, that can be really helpful. And those are often the same kinds of things we want pet owners and pet families to be looking for at home is just, are they eating and drinking? Are they laying in their normal places? Are they interacting with us in their normal ways? Because I think pet families know their pets better than anybody. And those little changes often mean a lot since they can't talk to us. We need to be watching for those changes at home.
Or a young dog is not interested in their food. Would you say that is a cause for concern?
I think it can be. Especially in a pet we don't know very well yet. I think we want to err on the side of caution. So if you have a new adoption, a new rescue, and they're not eating, maybe they're just anxious, but it's also a time where they're very stressed. They're exposed to a lot of diseases when they're in transit. And so it is something to bring to the attention, I think, of your doctor. I think appetite is definitely not the only sign of health. And as we get to know our pets better, we know there are going to be those pets that eat every morsel of food and those pets that are just going to let it sit all day. And that's just who they are. But seeing variation from that in your own pet is definitely a cause for concern.
Luke is definitely the first version. He eats everything, regardless of what, before he even knows what it is, it's in his belly. So I have to be very careful, but definitely a really important thing to watch when you first adopt a dog.
Absolutely. And I think that's just part of the basic things that I think are important to look at is, if a dog is eating, they should therefore be pooping, and paying attention to, are they pooping on a regular schedule? Are they peeing on a regular schedule? What goes in must come out. Some basic, just common sense type stuff is really important in general health. And sometimes we miss that looking for more obscure things.
I already have this like bullet note of what I want to take away, and it's really, you have to observe your dog, how they eat, how they poop, like you said. So I feel like that's a really great first lesson to give people that have just adopted a dog.
Yeah.
You could probably add on to that too, right? And the movement and the interaction, the engagement with right, their energy levels. There's so many things. I can't imagine the checklist or that full picture in your mind that you're trying to craft as you're doing an eval of a new client.
Yeah. And I think when we have clients and families into the exam room, we certainly have a list of questions we want to ask, as part of our normal history. But one of the most important things I think I learned over the years and from a lot of great people is you also want to stop and just listen to whatever feels important to the family at the time. Even if it's not the thing that I see that worries me most about the dog's health, there's something there that's going to be useful, and kind of letting people stop and say their full piece before you get into the other questions can often get a lot of useful information as well.
Makes sense. What are some of the most common ailments or common challenges that you're seeing with pet parents these days?
I would say the probably 3 most common things that we treat on a day-to-day basis are going to be allergies, which include both skin and ear infection type allergies, intestinal upsets of various types, and behavior problems, anxiety, especially in the city. I think it's more common here as we have smaller spaces, more people, more animals.
How different is your approach, big, small dogs? Is it fundamentally the same? Are there any really big differences? Any things that we wouldn't think of as just common dog parents, but you as a doctor know, small dogs are much more prone to X, Y, and Z versus big dogs?
Yeah, absolutely. And I think this goes along with when we talk about purebreds versus mixed breed dogs, but also when we're looking at rescue dogs and we don't know what their genetic background is, looking at how big they are can help us to know a little bit more about what health problems they might encounter. So small breed dogs, generally thinking dogs under 15 pounds, these dogs are going to genetically probably be more predisposed to dental disease is a big one. So we put a lot of focus on home dental care. The little guys, they're going to be more likely to develop heart disease as they age. But that said, they're also going to be more likely to live longer as little dogs. Big terriers, the bully mixes, which we love so much in the rescue community, they are generally more prone to allergies, skin problems, so that's something that we spend a lot of time on with them.
I'll do a whole episode with you on that another day.
Yes, absolutely. Big dogs are often going to have joint problems at a younger age. And while it's true for all size dogs, I think one of the most important things pet parents can do for any dog at any age is focus on healthy weight. There's a lot of good research out there to say more important than what we feed is how much we feed. And keeping our dogs trim can sometimes add as much as 2 years to their life.
Incredible statistic.
Yeah.
Wow.
So there have been a couple studies done, oftentimes with large breed dogs, because oftentimes we're looking at mobility and joint issues. But, in little dogs, we see heart disease, we see breathing problems more often, and their weight control also does help control symptoms. And we're talking about, when we talk about 2 years, we're probably talking about the fact that their quality of life is just that much better,
In terms of weight management, is there some things to look out for in case you want to just be able to easily spot, is that dog a good weight or not?
So the things that we do, because depending on how fluffy they are, it can be hard, and different body types, the things that we look at is we want to put our hands on the dog when we're assessing weight. So we're going to feel over the rib cage, and we're going to want to be able to feel the ribs without too much pressure. Almost like if you feel the back of your hand and sort of run your fingers across and feel the bones in your hand, you should be able to feel a dog's ribs without pushing too hard. Just behind the rib cage, we should have a little bit of a tuck, a little bit of a waist in most breeds. So those are 2 big things we look at. And then we will just look at overall muscling as well as part of our body condition score, and keeping in mind that if we have an idea of the breed mix, a greyhound is going to look different than a Labrador in terms of what's healthy. But every time your pet comes into the office, we do give them both a body condition score, which has to do with fat and weight, and we give them a muscle condition score that has to do with their muscle conditioning. And we look at those things from visit to visit, comparing them along with their weight to help us to make decisions about that.
This parlays us perfectly to the next question. Why is it so crucial for pet parents to take their dogs to annual vet visits or biannual vet visits instead of just waiting for their pet to be either sick or in an emergency situation?
I think that's a great question. And I really like this one because I think it's so important that we physically put our hands on pets periodically to check things like their dental health and their weight, to get ahead of problems, and just to check in on what's going on at home. Sometimes little behavioral issues, little things that don't seem significant at the time, had we addressed them early, would have become less big problems. I think a lot of people hesitate to bring their pets in for good reasons. It can get very expensive to take care of pets, and we worry about, well, how much is it going to cost? What tests am I going to have to do? And the thing that I tell people is it's much more important you come in to see me for an exam than we do a bunch of tests. We want to value that physical exam, that conversation, and that continuity of care is really going to, in the long run, get us to better care, probably with less expense.
I absolutely agree with that, because I know I've gone in several times with Luke because I fear that a lump that he has on his body might turn into something malignant. So catching these kind of things early and making sure that it's not malignant, that it's just something that I need to watch, it actually personally gave me such a great peace of mind getting that out of the way, because I know if I didn't go, that would be nagging in my brain until I did. So eventually, I got that peace of mind as well as the facts, and now I know what to look out for.
Yeah, and just behavior-wise too, I think that's another hesitation people have is, as having Luke, that dogs can be very scared at the doctor. It can be a very stressful situation for everybody involved. Nobody really likes going to the doctor.
Bodhi did. Bodhi loved you.
Bodhi loved it, yeah. But I think it's good for families to also reach out to us if they have any apprehension about, I think my pet's going to be nervous, I don't know what to expect, and doing some prep for the visit. Some pets do really benefit from anxiety medications before they come into the office, and there's a really good training program that a lot of us veterinarians have gone through called Fear-Free Practice, where we focus on giving dogs pre-medications before they come in, making sure we pick times of day for appointments when it's going to be less crowded or when they can walk through the side door to avoid crowds if their dog reactive, and just really doing a better job of pre-gaming for those visits so that they are less stressful for everybody involved.
Wow. I can personally testify to this. Luke's visits have been so much easier because of this process. And as the dog parent, I always stress out about this because I don't want Luke to go in and maybe snap at someone or be stressed and never want to go back. And so this process really helped him to not fear the place, but understand that it's a safe place. And I think with repetition, he's getting better and better with every visit. So it definitely works, and it works really well.
I would attest to that. And Luke's a great example of a dog that has both support of his home and his people and the staff, really coming together to make things better over time.
Yep.
That's amazing. I wish more practices in general would kind of learn and implement that approach when around dogs. I have a few reactive dogs myself, so I know even a somewhat seemingly aggressive bark or snap is actually a fear reaction. But that took a little bit to learn.
Yeah, and I think there's some great resources out there on the Fear-Free website, both for lay people and professionals, so I think that's a great resource also for pet parents if they're apprehensive, just to learn more, because I think a lot of people are also hesitant to, quote unquote, drug their dogs before they come to the doctor. But I think we need to maybe move past that concern and focus on the fact that we want everybody to be less anxious and be able to get through a full exam, because it's no good to your pet to come in and for me not to be able to touch them.
Absolutely agree.
That seems so important. Have you noticed a shift in the last 20 years? Like, is there more of an interest in preventative health versus people putting it off and waiting until then there's an issue?
I think overall there is. I think the younger generations, I think millennials in particular, maybe championed this, have really grasped onto the idea that pets are a member of the family, that we need to do everything to take care of their whole self, both their brain and their body, and have been more proactive in getting their pets in.
I'm proud of us millennials. Not of everything, but in this particular situation, I'm proud of us. So we're all about making pet parenting easier. If you could give a new pet parent any advice to do with health and wellness around their dog, what would that be?
I think a few basic things I talk to all new pet parents about. One is just being aware of and avoiding toxins both in their home and in the environment. It's something where you can really be proactive in learning what foods is safe for your pet to eat and what are not safe, what to do if your pet gets into something and your vet's not open and you don't know if it was toxic or not, and just sort of being prepared for those situations ahead of time. I encourage all new pet owners to have the pet poison hotline in their phone. I think that's a great resource. You can call 24 hours a day and talk to a veterinary toxicologist. You do pay for the call, but it's cheaper than an emergency visit by far in most cities. And they will let you know, do you need to go to the doctor? If you do, what to expect and what treatment's going to be needed. I think that's a really great resource. I talk to all new pet families about behavior and training. And while that is not my expertise as a general practitioner, I give them resources for trainers, veterinary behavioralists, talk about making sure we don't let the little problems become big issues. I think we're real easy at ignoring things that have not greatly affected our life yet, but might one day, and then they become bigger problems. And then we talk a lot about diet. I think most veterinarians don't have a favorite pet food. I think everyone comes in wanting the veterinarian to give them a favorite pet food, and there are a lot of great foods out there. We're lucky that the pet food market has really blossomed and there's so much available, but I also think we have to talk about some of the pitfalls of pet food as well and things to avoid. And like we talked about before, probably the biggest one is just overfeeding.
So the pet food and the industry is also another category we'd love to explore. So we'll be doing a lot of research on that end as well.
There's so many things, right? Like the trends of the grain-free diets or the raw diets. And it's overwhelming as an experienced pet parent to know what is the best diet for your dog. But it sounds like it's really specific to that individual dog. There's not one size fits all.
There really isn't. I think we can all give some basic tenets of what we want a pet to have in a diet. We want it to be something they love to eat. We want in New York City, we definitely want it to be something that makes a nice formed poop because we got to pick those up 3 times a day on the sidewalk.
Make
I
our
think
lives
the criteria, maybe if you live in the country or have a yard, is different. But, and then, we want it to be well balanced and safe for our pets, and I think these days the science tells us that there are probably some risks to both grain-free and raw diet, which is probably a topic for a whole nother episode. But
sure is.
Those are things that you definitely want to discuss with your veterinarian in regards to your pet's specific health and your family's, lifestyle as well.
To pick up our dog's poops that many times a day is that we can always observe it and see how their poops are doing, how their digestive system's doing. Is it too runny? Is it too hard? Then we can adjust our levels.
I would imagine we see a lot more diarrhea visits in New York City than they do in the country.
We know a lot of dogs don't like getting their teeth brushed, so a lot of people just opt to skip that part, right? But you mentioned oral health is so important. How crucial is brushing teeth or oral care for dogs?
So I think it is very important for most dogs, even if we're not brushing every day. And I always tell people, we may tell you it's appropriate to brush every day, and that's what the dental specialists say. I think it's really just important to have your dogs be comfortable with you touching the teeth, getting inside the mouth and looking at the teeth. Even if you can't make it to brush every day, you'll recognize problems. You'll notice if they have bad breath. You'll notice if they have bleeding gums. You'll notice if there's a broken tooth. And so I really encourage, especially puppy owners and new dog owners, just to get comfortable touching the teeth first. And we sort of do a slow program of first touching the teeth, then introducing dental treats and toothpaste as a treat, and then slowly work our way up to brushing over time. And, getting in there once a week is still better than not at all, So I think not holding ourselves to the standard of perfect, but still making an effort will improve their outcomes long term. So.
And no all or none, right? So any effort is better than nothing. So this is probably a myth then. All dogs have bad breath. That's just kind of something that's out there like, oh, your dogs are supposed to have bad breath. That doesn't sound like that's the case.
It really isn't. They have maybe different smelling breath than we do. And obviously we're not brushing their teeth twice a day, most of us. So they're going to have a little more tartar on their teeth at any given time than we will. So even dogs with fairly clean looking teeth will have some odor to their breath. But dogs that have periodontal disease and severe dental disease have really bad breath. And I can attest to that firsthand. So there is a difference.
And the smell can sometimes be an indicator of the health of the dog as well.
It can. Just like with people, there are other health conditions that might affect your breath. Things like kidney disease or diabetes may affect the way that your breath smells. So changes in breath may not just be a sign of a dental problem. Also, we see wounds in the mouth, tumors in the mouth that can also make a change in smell. So again, it's sort of a change from what's normal is going to be what we're thinking about there.
your recommendation of get your puppy used to having your hand in their mouth, that is one the top 3 things that I wish I knew when Modi was a pup, because it's so hard to get them used to it after. If you try to do it without having the transitions of getting them comfortable and getting them finally there. So that would be a really good tip for us to give new pet parents.
Yeah. We've talked about how we all want our dogs to live longer, and it seems like weight management is a big piece. Is there any other advice you would give to pet parents who want their dog to live as long as possible?
I mean, I think aside from healthy weight and basic checkups, the other thing I think we want to talk about is mental health. Are they getting enough exercise? Are they having enough interaction with their environment, enough to do? Some are lucky enough to work from home, but a lot of people work out of the house and have dogs that sleep on the couch 8 hours a day. And well, when they're young, they can kind of bounce back from that and be pretty healthy. As dogs age, we do see a lot quicker decline in mental health and brain health and increase in anxiety for pets that don't have more engagement with their environment, more novel stimulus in their day. So just basic play and getting dogs outside to smell and to walk is really important for health as well.
It's really good to know. Enrichment is also a huge part of a dog's life. And as you said, our generation is looking at the whole health. So we're looking at physical health, mental health. Are they stimulated enough? Is the lack of stimulation causing slightly destructive behaviors maybe because they're bored? All of these are really, really good things to keep in mind. And it's inspiring us to have topics for our next episodes. So I'm over here like writing things down on the side.
So many ideas. I think what you've mentioned too, the novel stimulus, the idea. So for us suburban and rural dog parents, right, I have a yard that's fenced in. So part of the appeal of moving from the city to the suburbs was having the yard to let the dogs go out. But I've recently learned that, no, actually, we need to make an effort to still walk them in new environments. The smells, the exposure, the people, sounds, everything, right? That's probably just as important for their mental health. They're not just going out, seeing the same things or smelling the same smells every day.
Absolutely. And it can be so simple. I mean, it can be as simple as feeding them out of a new container, or playing a new game with the same toys, or just walking in a different direction down the block. Dogs really are guided by smell, first and foremost. So giving them new things to smell is really engaging to them. And even for the dogs that maybe are older and don't want to walk as far, aren't as healthy, still getting outside. I have some parents of geriatric pets that will take them out in a carrier or carry them if they're little, and just get them outside to be engaging in the world is very helpful,
So, Dr. Witherell, you're the reason why I started taking weekly dates with Bodhi. So when I realized that his kidneys were declining and that he was having health issues, I started to take him out on weekly dates to different places, to meet different people, sometimes to meet his favorite people. And I could really see his spirit really liven up during those times. And it was some of the best memories that I've had. You told me that even with senior dogs, if you show them different experiences and different environments, it can really help with their brain health. So that's exactly what I did. It was such a tremendous time. So I have to thank you personally for that valuable tip, because it makes even mourning easier because I know I had those special moments. So thank you for that.
Oh, you're welcome. Bodhi was such a lucky dog to have you and all the people in his life. I know he was beloved by so many.
So my next question to you is, what are your thoughts on telehealth versus in-visit care?
I think there's a place for telehealth, absolutely. And we had a lot of time, for better or for worse, during the pandemic to explore the limits of what telehealth can offer, because we were in a situation where a lot of our clientele couldn't come into the office for various reasons. Even though we adjusted our practice to do drop-offs and curbside, we had people that couldn't leave the house. And so we started interacting with a lot of people in this way, over the phone, over Zoom. And I think it's a great way to check in with someone who you already have a relationship with. So I think there's a place for established veterinarians to use telehealth to maybe do med check-ins, to help someone determine, does their pet actually need to leave the house and come in, especially if they're older and sick. It can be used to look at changes in behavior and gait, and some of these other things we talked about are just how are they interacting with the environment, how are they sitting, how are they walking. There are some challenges to telehealth. Obviously, we can't get blood samples or urine samples. We can't touch the skin, and we can't listen to the heart. And so it's not a replacement for a complete exam, but I think there is a place for it. And there are a lot of new businesses popping up offering telehealth. And I think probably at their best, what they're helping people to do is really, determine, do they need to address this or not? How quick do you need to go to the vet? And,
yes.
And what can you do with that? And, in other circumstances, if we have someone that we already have a relationship with, it may help us to, maybe even treat something at least temporarily without them having to come in. A young, healthy pet is limping and needs some pain relief, or has a wound that could be cared for at home. Those are things
less serious issues that can be dealt with. The more important.
Yeah.
That makes sense.
Yeah, absolutely.
Yeah, there's a time and place for that. And I guess if they can get the right recommendation to come in, or if it is urgent, that would be a very important call as well.
Yeah, absolutely. Because I think that is a hard thing when vet practices are busy and there's a lot of phone calls and maybe some wait time to get a call back. Being able to just more immediately speak to someone and decide, do I need to go sit around at the emergency room for 4 hours, or, can this wait till tomorrow? That's a valuable thing sometimes.
Trying to bring our conversation full circle a little bit. You've been a practicing vet for over 20 years. What do you think is like one of the bigger trends or changes that you've seen as medicine has evolved while you've been practicing?
A lot has changed, and I guess a lot has stayed the same, but the things that are really notable to me, I think, is what's available to pet families in terms of medicine over the last 20 years. And it's probably changed a lot more for my predecessors, but we have specialists in almost every area of medicine for dogs now. We have neurologists and ophthalmologists and internal medicine specialists and behavior specialists. So having access to all that is amazing. It's also limited access that not everyone can afford or have access to those things depending on where they live. So that's one change.
There are areas that I never even heard about before that you told me. There are pet acupuncturists. I thought was really incredible because I personally have tried acupuncture and I love it. The fact that
Me too.
there is a specialized field for that for dogs is good to know and warms my heart because they deserve it.
Yeah, and that's actually one of the biggest growing fields right now, I think, in veterinary medicine is physical therapy and rehabilitation, which encompasses acupuncture, swimming, underwater treadmills,
I love that.
mobility assistance and all of that. It's a huge field that there's a lot more demand for than there used to be, which is great. I mean, we have 2 or 3 practices in the Metro New York area now, which is a lot. When I came, there were none. And that's really a valuable thing for those that have access.
You've given us so much incredible advice and learnings, and I could ask you a million more questions, but we so appreciate you joining us. I think, maybe we could try to recap just some of the bigger learnings because we talked about so much. I think off the top of my head, I would say just the importance of the regular vet visits, getting ahead of problems.
Prioritizing preventative care rather than waiting for an emergency to strike.
Mm-hmm. Exactly. I think also the importance of weight management and the balanced diet that a healthy size of a dog can help add life. Who doesn't want their dog to live longer? So that seems like so important. And I think also the idea of taking care of your dog as a whole, not just the physical health, but the mental health as well. And I think that's something we're definitely going to dive into as we kind of focus more on health and wellness, but also expand into training and behaviors and adoption and rescue and working pets. There's so many things we could talk about that's going to help serve our pets as the whole that they are.
Great.
And for new pet parents, to always observe your dog to see if there's any major behavioral changes, to make sure that they get used to you that the dog gets used to you putting your hand in their mouth and being comfortable with touching feet so that down the line, if they need to be observed and looked at, they're more comfortable to do that. And so they can have a better habit of brushing their teeth.
Amazing.
Thank you so much for joining us. We've learned so much in the past 30 minutes. I feel like my brain is turning and I'm so, so grateful that you shared your knowledge with us. And for those that are listening, please check out Animal Kind Veterinary Hospital in Park Slope. I've only had the most incredible experience. And like I said, my late dog, Bodhi, would actually love to go in there. He would strut in, and then, some people would recognize him by name, and then he would further be like, yes, I am here. And Dr. Witherell, he loved you so much. Like, he was always happy, and after coming out of the vet visit, he would have this walk, like he accomplished something great. He was like, yes. So it's always been so incredible. I'm so grateful to be a part of your community as well.
Thank you. And we all enjoyed Bodhi, as we do all of the pets that come to visit us.
And for everyone who's not in the New York area, you can follow Animal Kind Vet on Instagram, Facebook, and TikTok. Thank you so much for joining us for MythBarkers. We're excited for the next episode.